Okay, so we have Eva here. Eva is a patient with Fortress Physical Therapy, and I just wanted to share with everyone her journey on how she came to Fortress Physical Therapy, what she did at Fortress Physical Therapy, how valuable it was for her to come in for physical therapy, primarily through her second pregnancy. So Eva is here, and she was very active during this pregnancy. So this is her second child that she just had, and so Eva, if you can just kind of explain, why you came to Fortress, why you reached out to me, what promoted you, what you learned, what you took home with you while you were pregnant, and up to this point, how we are in the process 5 to 6 weeks post-pregnancy, postpartum.
Okay, so I met Amy through the gym, and so from that, I knew kind of what she did. And so during my first pregnancy, I had a lot of sciatic pain. And when I started my second pregnancy, I started noticing sciatic pain again about 4 months into the pregnancy. So knowing what Amy does, I decided to reach out to her about physical therapy. As more of a preventative way to make this pregnancy easier. Last time during my pregnancy, the first pregnancy, I had a lot of pain, and to the point that I almost had to call out of work. This time, because of going through physical therapy, I was able to prevent some of that pain to the point that I really wasn't having pain, not sciatic pain for sure. One of the things that we did was our first appointment was she kind of talked with me about what my experience was during the last pregnancy. I let her know how I was getting pain and numbness down one side of my body, so my right side. That pain would occur a lot of times when I was up and active more, and really was hindering some of my activity. From that, she did a lot of assessments during that first appointment and narrowed in on where that might be coming from. At the point of our first appointment, at that time, I was already starting to get a little bit of pain. So we were able to recreate what types of positions were causing that pain. And that informed how my course of treatment was going to go. From there, she provided me some exercises to do while I was in the office and while I was in the gym. I would continue with those exercises. I would say anywhere between 3 to 5 times a week. I would try and do them daily, but really it probably was more like 3 to 5 times a week. And that would kind of give me an idea of how I was doing with my pain and if anything else was going on.
Yeah. I think one thing too that we were able to hone in is comparing to your first pregnancy and then to the second one is you were able to maintain your exercise and activity level.
Yeah.
Right. Because the one thing that I saw from a clinician standpoint is your ability to do that. But then we were able to modify the activity because as your belly grew, right, instead of what we know, you and I know what a conventional deadlift is, we had to create what we call a sumo deadlift. So she had to be in a wider stance in order to accommodate for her growing belly in order to lift the weight off the floor. And she was still able to, what was your weight range? For example, the deadlift. What is your 1 rep max deadlift, non-pregnant, right? Like what were you able to lift one time off the ground?
I think the summer before this pregnancy, I lifted 280 pounds off the ground.
Nice.
During this pregnancy, I limited myself probably during during actual lift workouts to 155, and then during and more of like a speed workout where I was adding more and more to it, I was doing 135 and then went down, I think, eventually to 115 during those workouts just to keep up. One of the things that I found helped the most was the fact that I started noticing I was getting lower back pain. So I knew it wasn't sciatic pain, but my back was getting tight. And Amy was in the gym and was able to adjust what I was doing with the deadlift, where we raised it up off the floor. And in that hour-long stretch, I was then able to go from having pain in my lower back to not having any pain at all by the time I walked out of the gym. Just doing minor alterations actually probably impacted my, that first 10 minutes, what my pain level was.
Yeah, definitely. And so we raised the floor up to you in order for you to prevent going down lower. Yeah. So that was pretty cool. And I think one thing working with patients like yourself, Eva, and you're an avid exerciser, CrossFitter as well, is that like I'm a coach there too. So I'm a CrossFit level 2 coach, and I'm constantly around my athletes and patients. And right at that example that you just exposed, I remember, I think I was just like walking into the gym because you're a 5:30 a.m.er. So I would roll in at like 6:30 in the morning. And then you're like, I can't lift this. And I was like, all right, guess what? We're grabbing 45s and we're going to put that weight on those plates. So that therefore we shorten the distance between your length of how you have to pick it up. So I was instantly able to like see the difference, and like her face just like lit up. She's like, this is so much better. So just little things like that. And